Wet, wobbly, and wacky. What is that going to be associated with? Well, the real name is normal pressure hydrocephalus. The pressure inside of the brain is normal, and the ventricles are awry. So, in normal pressure hydrocephalus, we have gait disturbances, dementia, and urinary incontinence. There's this triad. So, we have the broad-based short steps, that's the wobbliness. The wetness is the urgent continence. They might pee themselves, feeling that they all of a sudden have to go. And then the wacky is the frontal lobe, like dementia, executive function, and apathy. So MRI, you could see ventriculomegaly. There's no sulcal widening. The pathophys, CSF accumulation from the impaired arachnoid granulation absorption. And also the stretches in the corona radiata, and also disruption of the cortical inhibition. So here's a practice question. 70-year-old man frequently falling, the gait is off, forgetfulness. He's been urinating himself. So there's our triad. We have it right there. It is our wet, wobbly, and wacky. All right, so ventricular enlargement disrupts the corona radiata. That impairs the descending cortical control, and he has uninhibited bladder problems. So the whole problem is due to decreased cerebrospinal absorption. This results in ventriculomegaly and normal intracranial pressure. So there's the stretching of the descending cortical fibers from the frontal lobe, and that causes all those things. So the loss of the cortical inhibition from the sacral micturition center causes the urge incontinence. So other trap answers, cerebellar atrophy would be your ataxia, but you wouldn't see the dementia or the incontinence. Spinal cord compression, that could cause your incontinence and gait, but it also has the motor and sensory defects that you don't see. Reticular formation causing altered consciousness. And your basal ganglia degeneration, that's your Parkinson's. You look for the bradykinesia, the tremor, rigidity, not early incontinence as much. All right, so there we have it. Wet, wobbly, and wacky, the hydrocephalus triad. Normal pressure, hydrocephalus, dementia, gait disturbances, urinary incontinence. So there we go, the corona radiata. See you in the next video.